Welcome to my channel. Pregnancy is a special blessing from Allah. However, sometimes we forget this blessing and plan to kill the baby in our womb. We even take various medication for abortion. The kit is one of them. When an unwanted pregnancy occurs, women often take this medication if there is a ulcer reducing medicine. Furthermore, in today's society, due to the immoral physical relationship under the guise of love, unwanted pregnancy occur. At that point, considering family and social status, there seems to be no other option but to terminate the pregnancy. Many people ask me whether taking the kit to terminate a pregnancy will cause any problem for future pregnancies. In today's video, we will discuss this topic in detail, inshallah. So, let's get started. Before that, we need to understand how the kit works to terminate a pregnancy. When a male's sperm and female's egg union through sexual intercourse, a zygote is formed. This union of sperm and eggs occurs in the fallopian tube. After missing a period, a urine test is done and the result is positive. It indicates pregnancy. Over a certain period, the zygote gradually moves from the fallopian tube to the inner part of the uterus known as the endometrium and implants here. When someone takes medication to terminate the pregnancy, this medication mainly causes contraction in the uterus, resulting in severe abdominal pain. Often this contraction expels the zygote from the endometrium, leading to bleeding and a miscarriage. Now, let me explain the potential harms to take abortion medication. This medication must be taken within a specific time frame. If not taken accordingly, there will be abdominal pain and bleeding, but zygote may not be completely expelled from the uterus. This condition is referred to in medical terms as an incomplete abortion. As long as the miscarriage remains incomplete and tissue is retained inside the uterus, bleeding will be continued. This can result in prolonged bleeding lasting 10 to 20 days or even a month, until the remaining parts of the miscarriage tissues are expelled. Bleeding will persist, potentially leading to a severe anemia and posing life-threatening condition. The treatment for an incomplete abortion is DNC, which stands for dilatation and curettage. Let me explain. Dilatation refers to a widening and curettage means escaping out. In the procedure, the cervix means the mouth of the uterus. Cervix is widened and the remaining part of the miscarriage tissue are scraped out. This process ensures that no remains of miscarriage is left inside the uterus. Additionally, an incomplete abortion can cause infection in the uterus and irregular periods may also occur. If you deliberately terminate a pregnancy and undergo a DNC procedure, several problems can arise. The cervix may be damaged, the uterus can be damaged and potentially perforated. Another common issue is called cervical incontinence. Normally during pregnancy, the cervix should remain closed. However, if for any reason the cervix opens during pregnancy, it can lead to miscarriage. Those who deliberately terminate a pregnancy may face this problem in the future. You might terminate a pregnancy now, but the subsequent pregnancies you might experience repeated miscarriage. So, I urge everyone not engage in the heinous act of terminating a pregnancy. Additionally, taking miscarriage medication increases the risk of ectopic pregnancy, which is a severe condition whether the pregnancy occurs outside the uterus, usually in the fallopian tube. This medication can sometimes cause the fallopian tube to become blocked, making it difficult to conceive in the future. This is because the eggs from the ovary travels through the fallopian tube to reach the uterus. After a DNC, an infection known as PID or pelvic inflammatory disease can occur in the uterus. This may cause prolonged abdominal pain even after a miscarriage. Often, Even after taking medication to terminate the pregnancy, the fetus may not expel. In such a case, it is crucial to consult a doctor to terminate pregnancy properly. The medication used to abortion are high dose and can cause a congenital defect in the uterus if the pregnancy continues. Therefore, if the medication does not result in complete abortion, it is essential to seek medical advice. So, due to these severe complications and risks, it is advised not to resort abortion unless absolute necessary and always under a professional medical guidelines. Now, the question is whether taking an kit will cause problem with conception in the future. Sign there is a risk of infection in the uterus, a risk of tubal blockage, and risk of subsequent miscarriage after an abortion. Taking abortion medication can indeed causes problem with future pregnancies. In some cases, has been observed that conceiving taking much longer after an abortion. In short, deliberately terminate a pregnancy can carry certain risks for future pregnancies. However, it is also true that most women are able to conceive normally after an abortion. It cannot be definitely said that pregnancy will be impossible afterward. I hope you will understand that. After taking this medication, there is a few important things to monitor. Number 1, bleeding. It is normal to experience light to heavy bleeding for 2 to 3 days after taking the medication. However, if you experience excessive bleeding, need to change pedicure every 2 hours, or if bleeding at least more than 3 days, it indicates a problem. Suggests that the miscarriage is not completely resolved. Number 2, abdominal pain. Light abdominal pain is normal after taking the kit. However, if you experience severe pain or if the pain persists for more than 24 hours, this can cause of concern. Number 3, unusual discharge. If you notice excessive white discharge or foul smelling discharge, this could be sign of infection. If you experience burning during urination or have a fever, it is essential to consult a doctor. This symptom indicates an infection that should not be ignored. In any of these cases, seeking medical advice is crucial to ensure there are no complications and to receive appropriate treatment if necessary. I will conclude with a verse from the Holy Quran. Whoever kills an innocent person, it is as if they have killed all of humanity. Surah Al-Ma'idah 32. If for any specific reason termination is necessary, do so under the guidance of gynecologists to avoid unnecessary risks to yourself. I hope you will understand. No more today. I hope today's video was helpful for you. If you find the video helpful, do not forget to share it with your friends. Please subscribe to my channel for get health advice, health awareness and reproductive health related all the videos. And remember to become a member of our family. Stay with us healthy and safely. Thank you for watching this video.